India is far from over. At the same time, the country is also reeling under the pressure of H3N2 influenza cases. Now that brings up the question, can you get COVID-19 and H3N2 influenza at the same time? Unfortunately, yes. It's possible for the two viruses to coexist. However, if that happens, the symptoms could be more severe in vulnerable groups. Both COVID and H3N2 are respiratory viral diseases and have similar symptoms. It is advised to get tested as soon as you get these symptoms. Fever, prolonged cough, body ache, sore throat, and weaknesses among others. Most patients who have both viruses don't need antiviral drugs, and treating their symptoms is enough. Only a small number of patients who are not vaccinated, have other health problems, or have weak immune systems might need specific antiviral drugs for both viruses. The ICMR has said that H3N2, a subtype of influenza, appears to cause more hospitalizations than other influenza subtypes. The symptoms are more severe in H3N2 than COVID, because most people have received 2 doses of vaccines for the latter. Now, symptoms of COVID-19 generally appear after 2 to 14 days of exposure to the virus, whereas patients can experience the symptoms of flu in about 1 to 4 days post-exposure. H3N2 influenza can be transmitted from one person to another through droplets released when coughing, sneezing, or talking by an infected individual.
ये बहुत अनयूजुअल नहीं है इस सीजन में वायरल इन्फेक्शंस होना। क्या अनयूजुअल है इस बार कि हमें कोविड जो 2 साल हमारे निकले हैं, हम लोग एक्सपोज नहीं थे, बच्चे एक्सपोज नहीं थे इन्फ्लुएंजा से, तो आपकी इम्यूनिटी नहीं डेवलप हुई। इसकी वजह से जो सडन आउटब्रेक हुआ है H3N2 जो एक वायरस है, ये एक नॉर्मल इन्फ्लुएंजा का वेरिएंट है जिसको हम कहते हैं एंटीजेनिक ड्रिफ्ट हुआ है। ये एक वायरस है जो इन्फ्लुएंजा का एक सब टाइप है। क्योंकि हम लोग एक्सपोज नहीं हुए थे पिछले 2 सालों से, इसलिए ऑल ऑफ सडन आउटब्रेक हम लोगों को लग रहा है।
Now, India is also seeing a rise in COVID cases. India recorded 1,300 cases of coronavirus on March 23rd. This is the highest number of cases in over 4 months, according to the data released by the Union Health Ministry. The number of active cases now stands at 7,605. Prime Minister Narendra Modi chaired a high-level COVID-19 review meeting to assess the terms of preparedness of health infrastructure and logistics. He highlighted that COVID-19 in India is far from over. There is a need to regularly monitor the status of cases across the country. On the other hand, H3N2 is a mutation of H1N1 virus. It spreads every year around this time. The number of cases is increasing because of the mutation. See a doctor as soon as possible if you think you have either of the viruses. One can also take preventive measures like wearing masks, covering your cough, and washing your hands and avoiding crowded places.